Hello, my name is Addison, and I was speaking on the affirmative side. The government should establish a healthcare system, and I'm responding to my opponent. And unfortunately, I believe there's some difficulties on his end. I'm not sure, but I'll be just addressing three main points that my opponent on the negative side would have made, which is taxes would increase, people will wait longer to receive medical treatment or checkups that would be too late, and inequality would reduce. So as you continue to listen, I will argue against the negative side, of course I just said, and justify my reasoning with logic and pathos to persuade that the government should establish healthcare. Many of those who go against my claim fear that prices would increase and may do more harm than good. However, many fail to realize that hospital bills are expensive. Anybody could fall into debt in any given moment, and yes, increasing tax could be the last thing the poverty will want to worry about. However, it's better than paying $1,000 bill because you had to stay at the hospital or you went to get a checkup. And the website, Polos, I believe, Medicine, stated to achieve net savings, a single-payer plans rely on simplifying billing and negotiating drug prices reductions, and as well as global budgets to control spending growth over time, replacing private insurances with a public system expecting to achieve lower net healthcare costs. This is by Christopher Kai, I believe. Really bad at pronouncing certain words. Secondly, the medical wait time may be longer than usual because everyone will have access to doctors and medical treatments. However, I believe that many doctors focus too much on costs and how much they receive from a medical procedure, and so installing the single payer system will force doctors to give the right treatment to patients' health and give them the best treatments they can possibly get. And on the website, thelessgroup.com stated accessible and affordable medical care might be one day be seen as right and more than a privilege. And then finally, single healthcare would make the nation healthier and even a better place to live. Many people need to get treatment they deserve because the cost is not affordable for them. It's very unfortunate knowing you can't be treated the same opportunities as a person who can afford it. And I found a website called Mint Life, and it read, one of the readings hit me, and it stated, in a private healthcare system, many citizens are unable to access primary health care and physicians and preventable medication due to their inability to pay. And as a result, these citizens rely on the emergency rooms as their primary access to medical care. And emergency rooms visits are very expensive, and often by the time citizen needs emergency medical care, their healthcare problems is much greater and more expensive one. So under the universal health care, all citizens have access to primary care and preventable medicines, and often nipping future health emergencies in the bud. And so it just gives people the same opportunities to get help and receive help and the right resources to better their conditions, and so they can work more, and so they don't have to say, well, I'm injured and I can't get it better because I don't have the money and now I can't work and stuff like that. So in conclusion, a single payer healthcare could be a great resource for financial aid and prevent people from going into debt with medical bills. And since we're in the process of healing from COVID-19, we all know that COVID-19 targets the respiratory system, and we need to replenish the people in our nation and get them better so that people can go out working, and then we have the right resources to open back up small businesses, as I mentioned in my previous video. And to add, our psychology class mentions how elderly people human body deploys over time, and it mentions how a few people use protective headphones unless it's required to, and 1 every 5 United States men aging 45 to 64 admits that they're having trouble hearing, and so they need hearing aids. And the problem is that most of their insurance does not cover for hearing aids, and so it's just left untreated. And these are grandparents, so when you live next door, let's take in a perspective of a grandparent losing their senses and resulting to them disconnecting from the world and their families and not being able to hear the voices of their kids and grandkids. So, thank you for listening. And yeah.